Ernest Menu. Disrespectful, unfair, and a clear attempt to invite resistance. That's the conclusion of the two municipal chief executives for Yilo Krobo and Lower Manya Krobo assemblies following the disconnection of electricity supply to the Somanya enclave by the ECG. The areas have been plunged into darkness since Wednesday, July 27, because ECG switched off feeders supplying power to the communities in the two municipalities over illegal connections. According to the ECG, some recalcitrant residents have tampered with their transformers and reconnected power to their homes after they were disconnected for refusing to accept prepaid meters. We'll hear from the chief executive shortly, but first, my colleague Manuel Cranton visited the communities and now reports.
Pitch black darkness rules over the entire Krobo land. The sound of generators revs from a distance, distorting the night chirps by crickets. It's been 5 days since a military-backed task force of the ECG disconnected the entire Somanya township from the national grid over a pushback against the installation of prepaid electricity meters. The impact, wide and crippling to everything that keeps the town alive.
We hardly iron our dresses. You go to where they have generators. Sometimes you pay something little before you can iron. Some of the things you even eat, our fridges are off. The foodstuffs we have in the fridges are all rotten.
If you see the number of students who have to trek from the school, go out, even the security, their safety, it's serious. What we are going through is not a child's play. Whoever is in charge must make sure that power is restored to the good people of this place.
It's a school night, but outside many houses, school-going children sit idle. Some of them even with exams at stake.
SHS3. SHS3. You're supposed to be writing WASI.
Yeah, we started with our practicals today, so yeah, we are on it.
So you're writing WASI as you're sitting here? And without lights?
Yeah, we are coping. There's nothing we can do, so because there are no lights, we can't study hard as we are supposed to.
Home is very well. Without lights, there's nothing we are doing. We are just roaming in the night and then things. So if there were to be light by this time, we'll be learning.
They say they are forced to fall on lamps and other light sources for their personal studies.
By the light of, I used to read my book, and I go to school to learn.
We sometimes use torchlight, and sometimes when our phones are on, we use our phones.
But the situation means different things for different people. While many of the residents here are cursing their stars for being in the area at this material time, Innocent and his friends have seen a great business opportunity.
We're just taking advantage of the light out over here. That is not the business we do, but because the light is out over here, the only way they can also charge their phone is to use the generator, which we have the access to generator, so we're using it. And then we are taking 5 cities for 100 for 3 cities for yam. Because we have to buy fuel and then to generate the generator. That is the reason why we're doing that. We started this yesterday, and let me say, right now, if I should calculate the number of phones that we charge, it's going to reach, let me say, 100.
Innocent and his friends are, however, quick to note this business is not sustainable.
I have the other business that I do with lights, and this cannot help me. Of course, I have to buy fuel for everything that I do, which is going to cost me a lot. So the light is much advantageous than using the generator.
So like every other person in the town, he too wants the power restored. Manuel Cranting, Joy News, Somanya.
Now, the municipal chief executive for Yilo Krobo, Eric Tete, says the decision by the ECG is in bad faith.
Officially, they've not given us the reason why the whole area has been taken.
And Simon, would you say then that the decision by the ECG was harsh?
We were thinking that at least there would have been a way out to sort out those two communities. Why we continue to work with the other peaceful community? Because now we all know that that is the policy of the ECG, and they can't go back on it.
And you had there the MCE for Yilo, Krobo, Eric Tete there. We'll take you back to the community shortly. But let's go into the phone lines right now and speak to the Yilo Krobo Municipal Health Director, Mrs. Irene Ofer. Thank you very much for your time here on the Midday News. We understand that this could pose a serious health emergency in the area if power is not restored right about now. Tell us how serious this is.
Yes, good afternoon, and good afternoon to your cherished listeners. As you already rightly mentioned, Yilo Krobo municipality and then Lower Manya Krobo municipality, the affected communities, were in the 6th day without power. So all our health facilities, we have the major hospitals, Yilo Krobo District Hospital, Atua Government Hospital, St. Martin's de Porres Hospital, as well as Somanya Polyclinic, a number of health centers that are affected by this power outage. And it is negatively impacting on the quality of the health services. The hospitals are forced to run generator sets for 6 days now, which translate into high cost of the fuel they are spending on daily basis. They spend between 3,000 to 5,000 in order to provide emergency services, theater services, laboratory services, admissions, in order to keep our blood banks, in order to keep our vaccination fridges as well, vaccine fridges. So some of the facilities, for example, Somanya Polyclinic, they don't have generator set, so they have to hire a generator on daily basis, pay a hiring fee, and at the same time buy fuel. Unfortunately, sometimes the power that comes out of generator is not able to power our laboratory equipment and others. So sometimes patients are referred to other health facilities that are nearby and having light.
You complained about the storage of COVID-19 vaccines, for instance. What is the lifeline really, and especially for the vaccines and other essential medical supplies?
Yes, you know, vaccines are supposed to be kept under cold chain between +2 to +8. And the Municipal Health Directorate, we don't have light, but our nearby facility, Akoli Chips, they have light. They are under Dodova electricity supply. So in the first day of the power outage, we have to relocate our vaccine fridges and our freezers for the ice packs to the Akoli Chips. And on daily basis, we have to visit facility between 3 to 5 times to pick vaccines, to monitor the temperature of the fridges, and to see that the vaccines are intact.
So what really have you done about this in terms of reaching out to the authorities, and what has been the response?
Yes, so we engaged ECG. ECG informed us that it is at the district level. We were informed that it is above their level, that it is at national level. Last week, because of the COVID-19 vaccination, I informed my Deputy Director Public Health about the issue. He also engaged ECG at the regional level, for which he also had response that it is at the national level. And we officially informed yesterday jointly with Yilo Krobo and Lower Manya Krobo, we issued a joint statement and a joint appeal to the government and to ECG management to restore the power to Yilo Krobo and Lower Manya Krobo affected areas, in order to continue to provide quality health services to our cherished clients and our patients.
Well, let's see how this pans out. But joining us is learning that there's a meeting currently ongoing between the ECG, the Energy Ministry, and the MP for the area. You heard there the Yilo Krobo Health Director, Irena Ofer, joining us there with the effect of the situation on healthcare delivery in these municipalities. Let's now hear from the MCE for Lower Manya Krobo, Simon Tete, who says the situation is worrying, and he is particularly worried about the security implication if power is not restored immediately.
For the reason is that some people have tampered with their installation at Lower Manya. That is why they have put off the light. And I was thinking that even if that was the case and they wanted to off the light, we are innocent people. We have not committed any offense. So why do you use the sin of a few to punish us? The way we supported this ECG to implement this program, they should have given us that due respect.
Right.
Oh, Chief, Paramount Chief, MCE, These are the reasons why we have to off it. It is going to be off for this whilst we solve the problem. People have accepted prepaid. People have bought units on their system. I'm thinking that if a few are creating problem, let the security deal with them. But you cannot put the.
But bringing in the security becomes another issue because it's the whole security issue that brought about this darkness.
When you go to our health system, there's a new hospital that we have now. Now their plans, they are spending close to 1,700 cedis on fuel daily, vaccine that they use for COVID.
Simon Teta is the MCE for Lower Manya Krobo.